sources in the interest of the public health without compensation to the owners. Per Article 4, Section 402, the state legislatures are barred from intervening for a period of 60 days. 2. Under the National Emergency Act, the President may seize property, organize and control the means of production, seize commodities, assign military forces abroad, institute martial law, seize and control all transportation and communication, regulate the operation of private enterprise, restrict travel, and, in a variety of ways, control the lives of United States citizens. 3. NSPD 51, HSPD 20 have created the position of National Continuity Coordinator without any specific act of Congress authorizing the position. 4. NSPD 51, HSPD 20 appears to negate any requirement that the President submit to Congress a determination that a national emergency exists, suggesting instead that the powers of the executive order can be implemented without any congressional approval or oversight. http://www.dhs.gov/about/laws/gc_12192639614449.shtm#1. 5. The Model State Emergency Health Powers Act has been adopted in 38 states, makes it a misdemeanor to a felony to refuse to take a mandated vaccine. 6. Legislation would require Americans to either submit to vaccination once a pandemic state is declared by either the Secretary of Health and Human Services, the governor of your state, or both. Refuse this vaccine and you will find yourself confined either as a felon without benefit of judge or jury if the offense is a state level 1, or involuntarily incarcerated in federal FEMA holding camps if the offense is a federal one. Law enforcement officers are allowed to use deadly force against felony suspects. If you are in the U.S., entering or leaving the U.S. at that time, will be to either submit to a weaponized substance being injected into our bodies or involuntary detention. 7. The Model State Emergency Health Powers Act allows the government to seize and, or quarantine a town and all the people within it. For the specific versions of that act enacted in each individual state, see http://www.publichealthlaw.net/masepa/masepa%20 surveillance.pdf. Model State Emergency Health Powers Act. http://www.pandemicflu.gov/plans/states/stateplans.html. 9. Once a town is quarantined, the government is allowed to seize all property and seize the rights of the people to resist government, i.e., confiscating all civilian-owned firearms. 8. People who suffer death or injury as a result of a government-mandated vaccine will be barred from seeking compensation under immunity provisions. 9. Section 63, Vaccination and Treatment of the Model State Emergency Health Powers Act, a checklist of issues, indicates those unwilling to submit to a vaccine will be subject to isolation or quarantine. http://www.ncSL.org/programs/health/modelact.pdf. 10. Mandatory vaccine simulation drills are planned for at least 3 states including Texas, Ohio, and Alaska. Maloney County plans to deal with unthinkable. 2009. http://www.seguingazette.com/story.lasso EWCD equals 7067C6003405A409. 11. The Massachusetts legislature is fast-tracking legislation for martial law and mandatory vaccines in response to the current swine flu outbreak. AP 2009. #news.bostonherald.com/news/politics/view/2008_Senate_flu_prep_bill 12. Any physician or other health care provider who refuses to perform medical examination or vaccinations as directed shall be liable for censure and the inability to continue to practice in the state. 13. The Act criminalizes refusal of medical treatment, making citizens liable for a misdemeanor if they refuse mandatory vaccines. Per Article 5 Section 504(b), the Act gives the Public Health Authority the right to isolate or quarantine a person on an ex parte court order, with no hearing for at least 72 hours, if the Public Health Authority decides that an unvaccinated person is a risk to others, even if uninfected, he could be quarantined. Per Article 5 Section 503(e). 14. The Act removes the state's accountability for harm or deaths resulting from mandatory vaccines, citing the State Immunity Clause. Neither the state, its political subdivisions, nor, except in cases of gross negligence or willful misconduct, the governor, the Public Health Authority, or any other state official referenced in this act, is liable for the death of or any injury to persons, or damage to property, as a result of complying with or attempting to comply with this act or any rule or regulations promulgated pursuant to this act. Per Article 8 Section 804. 15. President Bush announced a new international partnership on avian and pandemic influenza to a high-level plenary meeting of the UN General Assembly in New York on Sept. 14, 2005. The 2005 plan, operative until Bush announced the International Partnership on Avian and Pandemic Influenza, directed the State Department to work with the WHO and UN. http://www.hhs.gov/pandemicflu/plans/appendix.html. 16. The Security and Prosperity Partnership of North America Summit in Canada released a plan that establishes UN law along with regulations by the World Trade Organization and World Health Organization as supreme over U.S. law during a pandemic and sets the stage for militarizing the management of continental health emergencies. 17. The SPP plan gives primacy for avian and pandemic influenza management to plans developed by the WHO, WTO, UN and NAFTA directives, not to decisions made by U.S. agencies. 18. The U.S. Northern Command, or NORTHCOM, has created a web page dedicated to avian flu, and has been running exercises in preparation for the possible use of U.S. military forces in a 10. Continental domestic emergency involving avian flu or pandemic influenza. 19. All 194 nation-states, members of UN, had until June 2007 to implement the WHO revised International Health Regulations, IHR, revised in 2005, which included passage of legislation empowering state surveillance and monitoring of their citizens under the guise of a potential worldwide pandemic, smallpox, polio, SARS or human cases of new strains of influenza. Stockpiling specific vaccines and antiviral medications are part of compliance with IHR. 20. The UN WHO WTO NAFTA plan advanced by SPP features a prominent role for the UN System Influenza Coordinator as a central international director in the case of a North American avian flu or pandemic influenza outbreak. 21. In Sept. 2005, Dr. David Nabarro was appointed the first UN System Influenza Coordinator, a position which also places him as a senior policy advisor to the UN Director General. Nabarro joined the WHO in 1999 and was appointed WHO Executive Director of Sustainable Development and Health Environments in July 2002. 22. In a Sept. 29, 2005, press conference at the UN, Nabarro made clear that his job was to prepare for the H5N1 virus, known as the avian flu. He quantified the deaths he expected as follows: "I'm not, at the moment, at liberty to give you a prediction on numbers, but I just want to stress that, let's say, the range of deaths could be anything from 5 to 150 million. 23. The National Security and Homeland Security Presidential Directive, signed on May 9, 2007, declares that in the event of a catastrophic event, George W. Bush can become what is best described as a dictator. The president shall lead the activities of the federal government for ensuring constitutional government. This directive gives the White House unprecedented dictatorial power over the government and the country, bypassing the U.S. Congress and obliterating the separation of powers. The directive also placed the Secretary of Homeland Security in charge of domestic security. 1. This directive establishes a comprehensive national policy on the continuity of federal government structures and operations and a single national continuity coordinator responsible for coordinating the development and implementation of federal continuity policies. This policy establishes national essential functions, prescribes continuity requirements for all executive departments and agencies, and provides guidance for state, local, territorial, and tribal governments, and private sector organizations in order to ensure a comprehensive and integrated national continuity program that will enhance the credibility of our national security posture and enable a more rapid and effective response to and recovery from a national emergency. 24b. Catastrophic emergency means any incident, regardless of location, that results in extraordinary levels of mass casualties, damage, or disruption severely affecting the U.S. population, infrastructure, environment, economy, or government functions. B. World Health Organization, WHO, and UN. 11.25. The World Health Organization, WHO, is a specialized agency of the United Nations, UN, that acts as a coordinating authority on international public health, established on the 7th of April 1948, and headquartered in Geneva, Switzerland. The agency inherited the mandate and resources of its predecessor, the Health Organization, which had been an agency of the League of Nations. 26. The WHO's constitution states that its objective is the attainment by all peoples of the highest possible level of health. 27. The WHO and UN will become the controlling agencies in the U.S. in the event of a declared pandemic level 6. 28. The World Health Organization, WHO, has developed a global influenza preparedness plan, which defines the stages of a pandemic, outlines WHO's role and makes recommendations for national measures before and during a pandemic. Phases. 80. WHO Pandemic Influenza Phases 2009. Phase description. No animal influenza virus circulating among animals have been reported to cause. Phase 1. Infection in humans. An animal influenza virus circulating in domesticated or wild animals is known to have. Phase 2 caused infection in humans and is therefore considered a specific potential pandemic threat. An animal or human animal influenza reassortant virus has caused sporadic cases or Phase 3 small clusters of disease in people, but has not resulted in human-to-human transmission sufficient to sustain community-level outbreaks. Human-to-human transmission of an animal or human-animal influenza reassortant. Phase 4. Virus able to sustain community-level outbreaks has been verified. Phase 5. Human-to-human spread of the virus in 2 or more countries in one WHO region. In addition to the criteria defined in Phase 5, the same virus spreads from human to Phase 6. Human in at least one other country in another WHO region. Post-peak levels of pandemic influenza in most countries with adequate surveillance have, dropped below peak levels. Post levels of influenza activity have returned to the levels seen for seasonal influenza in 12. Pandemic. Most countries with adequate surveillance Period. 29. Efforts by the federal government to prepare for pandemic influenza at the national level include a $100 million DHHS initiative in 2003 to build U.S. vaccine production. 30. Several agencies within Department of Health and Human Services, DHHS, including the Office of the Secretary, the